Okay, so today we're going to take up the test for the other reducing substances, other sugar. So generally, our Benedict's test provide us with preliminary testing that if that one give a positive result that the substance that present in your urine sample is a reducing substance. Remember that there are several reducing substances that might react or giving a positive result with your Benedict's test. Not only your glucose, but as well as your sucrose, okay, and not only your glucose but your lactose. Could also have your pentose or maltose and fructose and other sugar. And we don't want the patient to have interpretation that the patient is diabetic because it won't give a positive result the Benedict's test. To rule out what specific na reducing sugar is present on that, then you perform here the test for the other reducing substance. The first one for the test for the fructose. Okay, the fructose usually increases in the patient body if the patient would have a high ingestion of the fructose or fruits containing food or fruits. Another one, fructose also increased in the patients with the problem deficiency of the fructokinase where it could not catabolize your fructose to your fructose 6-phosphate. Okay, and therefore your fructose try to be accumulating on our plasma as a fructose without converting that one to other substance. Okay, we have here the test for the fructose. So we have your Siliwanov's test. Procedure for that, just transfer 3 ml of your Siliwanov's reagent in your test tube. Then transfer 1 ml of your urine sample. And then try to heat for 30 seconds. And try to observe here for the color reaction, which is your red colored solution. So pag nag-positive siya after heating process, then we consider that one as a positive. So for this one, just report that one with interpretation and observation. So pag sabing observation, that's what's the solution, what will the color of the solution, is there a precipitate or something like that. And for the interpretation, then you need to write positive or negative. Okay, the next one, we have here the test for the lactose. So we have your Rapner's test. Procedure for that, transfer 10 ml of the urine in a test tube. Then you add 3 grams of your lead acetate. And then try to filter, okay, your entire solution. And then try to set aside the filtrate. Ang filtrate natin ang the liquid portion. Ang precipitate mo sa taas, do not include that one. Just get the filtrate na nasa baba, that's a liquid solution. And try to use that one as your sample for the continued process. Okay, if you have already your filtrate, try to heat that one for a few minutes until you try to produce your yellow solution. Then after that one, you add your ammonium hydroxide and try to observe here for the brick red na precipitate solution with the brick red na solution plus cherry red na precipitate. At then sa taas niya, since nasa bottom siya, ang ating brick red na precipitate, okay, the cherry red na precipitate, ang taas na portion niya, that's a colorless. So for this one, again, you write the observation and interpretation. Pag sabing observation, that's the color of the solution, the color of your precipitate. And for the interpretation, you write if it's positive or negative. Okay, the next one, we have here the test for galactose. We have here the mucic acid test. Procedure for that, we have here 5 ml of the urine. You put that one in the test tube. Then you add 1 ml of your concentrated nitric acid and try to boil until it will be reduced to 1 ml na lang. With your 1 ml, you put that one, transfer that one in your Petri dish and try to allow it to evaporate overnight and observe here for the presence of your white precipitate or white crystals. So the formation of white crystal here would identify the presence of your lactose or even the presence of your galactose or even your lactose. Remember that your lactose came from your galactose. Your lactose came from your galactose diba? Your lactose broken down to your glucose and galactose. So if the urine contains the lactose or even the glucose itself na naka-hydrolyzed na, so it will give a positive result with your mucic acid. Okay, the last one, we have here your test for the pentose sugar, 5-carbon sugar. This is your biosorcinol that will help us differentiate between your pentose and the hexose. In the presence of the pentose sugar reacts with your acid, converting that one to your 4-furyl. We try to condense with our orcinol in the presence of the ferric iron Okay, that would eventually be producing here bluish green na color solution. Okay, procedure, we have here 2 ml the urine in the test tube, then you add 5 ml the bios or sinol, try to heat that one until it try to boil, and try to observe here for the bluish green color solution. So again, for our observation, try to write the color of the solution, and for the interpretation, try to write here the result if this one is positive or negative. Okay, thank you.